Hello, this is Dr. Rodolfo Oviedo. I'm the Medical Director of Bariatric Surgical Services and Robotics Program at Nacogdoches Medical Center. And it is my pleasure to begin our seminar entitled Metabolic and Bariatric Surgery, Gaining Life While Losing Weight, on behalf of the Nacogdoches Center for Metabolic and Weight Loss Surgery. I would like to welcome you all to Nacogdoches Medical Center and our program. I would like to discuss our metabolic and weight loss surgery program, including the types of procedures that we offer to the community, the risks and benefits associated with surgery, pre-surgical assessments, and a description of our post-operative resources for our patients, in addition to the next steps. In other words, if you believe that you may be a candidate for metabolic and bariatric surgery, what steps should you take to begin your journey towards a healthier life? It is no secret that in the United States of America, we have an epidemic, which is the severe obesity epidemic. When I was a medical student, more than 35% of the US population was suffering from overweight and obesity. Now it's higher than that, and it's actually getting worse. And a lot of patients are suffering as a result of obesity-associated diseases, including diabetes, several types of cancers, hypertension, stroke, and many others. And for the first time in more than a century, more people in the world are dying due to complications from obesity compared to people dying from starvation or underweight. And it's really ironic, but most of this happens in countries that belong to developed societies where there are more resources, and unfortunately, poor choices are made in terms of nutrition, quality of life, sedentary life, etc. And so in the United States and many other countries in the world, we're dealing with this epidemic, which is actually of pandemic proportions. And let's talk about the elephant in the room, so to speak. So why would you consider coming to Nacogdoches, Texas, this beautiful city in East Texas, when you could actually go to major cities, major cities in the vicinity? And the reason is because we have a comprehensive program that has everything that you need to be successful. Nacogdoches Medical Center is well positioned and prepared to offer metabolic and bariatric surgery to patients with the highest standards of quality and the latest technologies, including robotic surgery. And Nacogdoches Medical Center is actively seeking accreditation by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, which is called NBSAQIP. And hopefully we will obtain that by the year 2024, if not by the year 2025. We offer a one-stop shop for weight management services, including pre-surgical assessments and post-operative support. And we always maintain a collaborative, multidisciplinary team approach with compassionate care for our patients. A little bit about me. I graduated from Houston Methodist General Surgery Residency Program more than 10 years ago. And then I went on to train for several years, for a decade, to become the robotic, metabolic, and bariatric surgeon that I am today. And I have undergone extensive training. I continue to learn every day. And I also teach my peers. I attend conferences as a lecturer, as a presenter. And I always learn and continue to write manuscripts and chapters in order to be the best surgeon I can be for my patients. I am a fellow of the American College of Surgeons, also a fellow of the American Society for Metabolic and Bariatric Surgery, and a fellow of the International College of Surgeons. I am faculty and clinical professor for two major academic universities in the greater Houston area. And I also serve as the CEO of TRUX, which is an international organization dedicated to the dissemination of education on robotic surgery, which is called the Robotic Global Surgical Society. Most of all, I'm very proud of being the medical director of Bariatric Surgical Services and Robotics Program at Nacogdoches Medical Center. My goals are twofold for my patients. Number one, I would like to offer them metabolic and bariatric surgery, especially to those patients who suffer from severe obesity and related diseases. And number two, I would like to help them to eradicate or control their obesity-related diseases while they lose excess weight and learn to live a healthier life. And I always tell this to my patients that weight loss is guaranteed. You will lose weight. The main reason to do this is not necessarily for weight purposes, but to have a healthier quality of life and a better health status, to be able to control your medical problems that if they're not affecting you today, they will affect you tomorrow, and they will limit your quality of life. Are you a candidate for metabolic and bariatric surgery? Well, we have to look at the BMI, which is the body mass index. It's a simple calculation that takes into account your height and your weight. And it's usually a two-digit number. And if your BMI, if you look at it, look for it in a search engine, for example, in Google, you're going to see a calculator that will calculate that number for you. You just have to input your height and your weight, and you'll get this two-digit number, which is a 35 or higher. If it's at 35, you already made it. Medically speaking, you already qualify for metabolic and bariatric surgery. Now, if it is between 30 and 35, we just need to make sure that we document at least one disease that has to do with obesity, such as diabetes, hypertension, heart disease, obstructive sleep apnea, reflux, and so on. Some of the ones that you see on the screen. Now, we also have to document a history and documentation about successful weight loss attempts. And usually we work with your primary care professional so that we can document that on your behalf and you get approved by your insurance company. If you're doing this by insurance, of course, even though at the Nacogdoches Center for Metabolic and Weight Loss Surgery in the Nacogdoches Medical Center, we have developed a very competitive, comprehensive system, a private system for patients who do not have benefits for metabolic and bariatric surgery, which is actually very competitive and affordable and competes with some of the most important centers surrounding us in major cities in Texas. The types of procedures that we offer at our program are everything you can imagine and you can look at, as far as first-time surgery, which we call primary metabolic and bariatric surgery, or revisional or redo metabolic and bariatric surgery. That includes the sleeve gastrectomy, which is the most popular procedure in the United States and worldwide. Also, the Roux-en-Y gastric bypass, which is quite effective, especially against diabetes and heartburn or reflux, including the single anastomosis duodeno-ileostomy with sleeve gastrectomy, which we call SADS, which is an exciting procedure that is quite effective on patients. It has fewer side effects or complications, and we'll talk about that. And we also perform revisional metabolic and bariatric surgery, which means conversions, reconstructions, reversals, removals, stage procedures, and advanced endoscopic procedures as part of our endobariatric program, which we also offer to our patients. If you would like to know a little bit about robotic surgery, what it means to perform robotic surgery, which is one of my areas of expertise and passion, I invite you to look at this article that came out in the United Kingdom a few years ago and talks about my work and research on the topic of robotic, metabolic, and bariatric surgery over a decade. I invite you to take a screenshot and look at this article, which is really interesting. Let's talk about the first procedure, which is the sleeve gastrectomy. As I mentioned before, this is the most popular procedure in the US, but also in the world. And it is quite effective. It's a great operation. It's relatively simple to grasp or understand because it only involves manipulating the stomach anatomy. It has nothing to do with manipulating the intestine anatomy, even though it has profound effects on your metabolism. And it is also known as vertical sleeve gastrectomy. In the past, people used to say vertical sleeve gastrectomy. Nowadays, we understand it's vertical, so we just say sleeve gastrectomy. It is a restricted procedure because it reduces the size of the stomach, but it's also hormonal because it removes 80% of the stomach. And in that 80% portion of the stomach that we take out from your body, you make a hormone called ghrelin, which is one of the most important hormones that regulate hunger. And so when we take that portion out, the hunger levels, the hormone regulating hunger, the levels drop. And so you're not as hungry anymore, even though hunger is a complex mechanism. And we don't presume to attribute that to only one hormone, but it is important to know that the hunger levels decrease. And it's also a malabsorptive procedure, even though in the past we didn't think about it that way, but it does affect malabsorption in a way. And so because of that, we recommend taking multivitamins and iron supplements every day for the rest of your life, even when you have a sleeve gastrectomy. This is not only for bypasses or more complex procedures, even for the sleeve. It's very important to take multivitamins every day. The EWL stands for excess weight loss. And so this is a measure that we consider in the United States of America. In other parts of the world, they actually talk about total weight loss or TWL. In the US, we tend to think about it in terms of EWL. What does that mean? Well, the excess weight loss is just like it sounds. It's the excess weight that you carry with you that you're not meant to carry. In other words, if you subtract your ideal body weight, let's presume that you're an Olympic athlete going to the Olympics in Paris tomorrow, then you would be pure muscle, very little fat in your body. So you'd be at your ideal body weight. Okay. So if you subtract that perfect weight, so to speak, from your current weight today, that equals your excess weight that you're carrying and you're not meant to carry. So if you multiply that by 0.6, which is 60%, that is the weight that you will lose with the sleep in 1 year. Now, does that mean that you stop right there? No, not at all. You can continue to lose the other 40% the year after, and so on, with nutrition, dietary counseling, exercise, etc. And this is a program for life. We just don't operate and leave you alone. We are with you for the rest of your life, and we counsel you, and we're here for you. Now, it involves, as I mentioned, removal of 80% of the stomach, which promotes the feeling of fullness with smaller amounts of food. It preserves the pylorus, which is the muscle gatekeeper to the small intestine. It's a muscle at the end of the stomach. And it's a muscle at the very end of the stomach that controls emptying. And so it preserves that, which is important because then you can regulate your stomach emptying, and you don't have as much incidence of what we call dumping syndrome, which happens with other procedures like the gastric bypass. It's ideal for patients with a body mass index less than 50, but with no significant type 2 diabetes or reflux. Now, does it mean that we cannot perform it if your BMI is over 50? Of course not. We can still do it. It's just that it's not as effective or powerful. We have other procedures that work at higher BMIs, but it still works. Now, type 2 diabetes, it's okay to do, it's good, but it's not the greatest. We have other procedures that are more powerful for diabetes. And for reflux, it may actually cause more reflux, unfortunately. So that's an Achilles heel of this procedure. If your reflux or heartburn is not that bad, we can still perform it. Granted, we have to do an endoscopic evaluation in which we take a look inside the stomach and the esophagus with an endoscope, with a camera. We go in, and I perform that personally. And that way we know if you have any absolute contraindication to a sleep, but most people will be okay. Now, if you happen to have a hiatal hernia or diaphragmatic hernia, we can still fix it during surgery. That's not a contraindication. The only absolute would be, for example, having a condition called Barrett's esophagus, which is a condition in which the cells from the esophagus at the line where you have the exposure to reflux, they begin to transform themselves, and they want to become something else, like stomach. And so in that case, that is a risk factor for future esophageal cancer. And because of that, the sleep would be contraindicated. We would have to talk about other procedures, such as the Roux-en-Y gastric bypass. On the other hand, I am happy to report that the sleeve gastrectomy, over multiple studies and literature over the last decade, has been shown to have the lowest risk of complications. And it usually requires 1 hour of surgery with the robotic technology. I performed that myself. And it requires 1 night in the hospital. Or in some cases, it may even be done as an outpatient procedure. More on that when you come to the office and we discuss it, depending on whether you would like to have it done under your metabolic and bariatric benefits with insurance, or if you do not have that, then we have a private system, and we can talk about that. But it could be potentially done as an outpatient procedure, but in most cases, patients stay 1 night in the hospital. I would like to show you a video or a diagram or a cartoon where you can see what the sleeve looks like. So bear with me. Let me show you this video, and then I'm going to comment on the next procedure.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdominal cavity using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is mixed with digestive enzymes to help break down the food to a more simple form, so that it can be more easily digested and absorbed when it is in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy changes signals in the body. resulting in decreased hunger and increased feelings of fullness after meals. The bile and pancreatic fluid from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments needed for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Okay, so that was the sleeve gastrectomy. On the other hand, the Roux-en-Y gastric bypass has been around for a longer time. It is also a procedure that is quite effective, and it's performed robotically as well. And it is a powerful procedure because it has restrictive characteristics. It is also hormonal, and it is malabsorptive. So it's even stronger than the sleeve. With the sleeve, remember that the excess weight loss in a year was 60%. With the bypass, it's even more significant. It's 75%. So you lose more weight with this one. Now, that may not be much of a difference when your BMI is relatively low for what we do, such as 35 or in the 40s. But if your BMI is over 50, mathematically speaking, the difference is much, much larger. The excess weight loss is 75% again. There is redirection of food to a surgically created stomach pouch about the size of a chicken egg that bypasses 1/4 of the small intestine. You still have 3/4 of the bowel working normally. It's just that we're skipping or bypassing about 1/4, 25%. And because of that, you don't absorb as many calories as you would normally absorb. There is altered absorption and restriction of some vitamins and nutrients. So that's why it's so important to make sure that you're taking your multivitamin and your iron every day. It's ideal for patients with type 2 diabetes. Even those on insulin, it's extremely, extremely efficient for type 2 diabetes. And for severe heartburn, there's no better thing in the world. It's actually the best procedure for heartburn because of the reconstruction. The Y-shaped anatomy makes it virtually impossible for bile and for acid to reach all the way up and go against gravity to make it to the esophagus. So in other words, if you are someone who suffers from severe heartburn, definitely consider this one rather than the other ones, because there's no better procedure if heartburn is a problem for you. And it's ideal for patients at any BMI. So if your BMI is 60, 70, it really doesn't matter. It's going to be powerful enough to make you lose enough weight and be healthier. This one requires 1 to 2 nights in the hospital, but again, it's done robotically. And it takes about 90 minutes to do. Sometimes it could be up to 2 hours if it's extremely difficult, but usually no more than that. And again, if you have a hiatal hernia, we can fix that hiatal hernia or diaphragmatic hernia at the same time. I would like to show you another diagram and illustrate what the gastric bypass looks like.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling. Small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into 2 sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested.
So as you could see, we're bypassing about a quarter of the intestine, and that's how you don't absorb all the nutrients that you take in. But you do absorb enough so that you're healthy. You don't become malnourished. Finally, I'd like to show you this one, which is the what we call the SATI or the SATI S. As you can see, there is an anatomy consistent with a sleeve, but the sleeve is connected to the intestine with a loop of intestine. So you're almost bypassing half of the small bowel. And so it's almost like the best of both worlds. You have a sleeve, you have a bypass, but it's not a Y-shaped bypass like the Roux Y. And so you avoid some of the side effects or potential complications that come with a Roux Y gastric bypass. But at the same time, it's not the best in the world for patients with heartburn. But for diabetes, it's phenomenal. And for the weight loss, even superior to the gastric bypass. So I would say if your BMI is over 50 and you're diabetic, absolutely consider this one. It's an amazing procedure, and we do it robotically as well. But if you have reflux, then consider the bypass. And so I'm going to show you a video. This time I'm going to narrate it myself for the sake of time. Remember, these are diagrams or cartoons based on laparoscopy, but we do this with robotics. So instruments moving like the human hand.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera.
Remember that the most important thing here will be making a sleeve and then bypassing about half of the intestine with a connection between the sleeve and the intestine. So I'm going to show it now.
The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. The single anastomosis duodenal switch, or loop DS, begins with a sleeve gastrectomy in which a thin vertical sleeve is created using a stapling device. This sleeve will typically hold between 100 and 150 milliliters and is about the size of a banana.
This sleeve is usually a little bit bigger than the typical sleeve, and so you can actually eat a little bit more, and it's okay.
The resected portion of the stomach is removed. The small bowel is divided approximately 3 centimeters beyond the stomach, preserving the pylori. The end of the small bowel is located, and about 3 meters of small bowel are measured. At this point, a loop of the small bowel is brought up to the duodenum and joined as shown. By altering the anatomy of the gastrointestinal tract by creating the gastric sleeve and altering the path and anatomy of the small bowel, the single anastomosis duodenal switch changes signals in the body, resulting in decreased hunger and increased feelings of fullness after.
So now the food follows this trajectory and you're bypassing about half of the intestine. So just to conclude, we also perform revisional metabolic bariatric surgery for all of the indications you see on the screen. That's to fix problems or complications or to help patients who have experienced weight recurrence after having undergone metabolic and bariatric surgery in the past. We perform the investigation and we help them qualify for surgery. And we do all of those procedures and beyond, much more. The benefits from metabolic bariatric surgery are so many that I would need much more time to finish telling you about it, but all of the ones you see on the screen plus so many more. And honestly, it's not only physical, but also mental health benefits, more confidence, more productivity. It's just impressive. It's a beautiful thing to be able to give patients quality of life and more years of life. There is a need for pre-surgical education, and that includes a psychosocial evaluation by a behavioral therapist that's necessary, and also a nutrition type of education by a certified dietitian. That could be anywhere from 1 to 12 visits, depending on your insurance, or if you're doing it privately, I do one visit with the dietitian. That's important, very, very important, so you understand what you are about to enter or face. We have so many resources for post-op support, including apps, including online stores, including monthly support groups, which are led by a phenomenal leader, nutritional consultations. We really have it all for you to be successful in our program. And the next steps really are just to call my office at the number that you see below, and we will perform the screening and find out if your insurance has benefits for metabolic or bariatric surgery. And if it doesn't, we will gladly tell you about our private self-pay program from the hospital, and then you will be able to make a decision. And we have many resources for you. Please let us know. And we are located just behind the hospital. Your weight loss journey, remember, it is your personal journey, and we're with you every step of the way. We are almost like your best friends. We're with you for the rest of your life, and we will make sure that we do not abandon you. Metabolic and bariatric surgery is just a tool, it's a catalyst, but you are the main determining factor. Your determination, your heart, your mind, your spirit. Success depends on you taking an active role in your weight loss journey. You have to make sure you follow up with us and with your primary care physicians regularly. You have to establish healthy routines through diet and exercise. Drink a lot of water, be active, have a healthy lifestyle, take your vitamins and supplements. You have to surround yourself with good people, supportive people who believe in you, who will push you forward. And remember, we are here for you at the Nacogdoches Center for Metabolic and Weight Loss Surgery and at Nacogdoches Medical Center. So this concludes my presentation from beautiful Nacogdoches, the oldest town in Texas, from East Texas in the Lone Star State. We welcome all of you. Thank you so much for your attention. I look forward to meeting you personally and speaking with you about my passion for metabolic and bariatric surgery. It will be our pleasure to meet you and welcome you in our program. Thank you.